Over the past few weeks, you must have heard that the number of COVID-19 cases in India were coming down. At the same time, a government expert committee released a mathematical study which suggests that COVID-19 might have peaked in September. If you put the two together, the drop in cases as well as the study, it's so tempting to believe that the worst is over. But is this true? I'm Suraksha and welcome to our weekly COVID update, Coping with Coronavirus. For months now, we've been flooded with COVID-19 information and we're all tired of it. But let's not take our eye off the ball yet. Each week, we look closely at one COVID-19 story. This week, let's talk numbers.
The testing rates per se are definitely much lower as you move away from the metros and the major urban areas. In addition, the choice of tests that we are doing in the other areas is also doubtful. Most people might be still relying on rapid antigen test without the symptomatics getting tested again with RT-PCR. As a result of all this, the numbers might be lower.
As Dr. Babu said, there are several reasons why the numbers have dropped. Low numbers clearly does not mean that we are out of danger yet. Every pandemic goes through several stages, and Adam Kuchersky, a scientist at the London School of Hygiene and Tropical Medicine who studies how diseases spread, describes 4 distinct phases: spark, growth, peak, and decline. The cycle can begin again and can happen multiple times before the pandemic subsides. In other words, if the testing is the same as before, but the numbers are still low, that indicates we may be in the decline phase. This does not mean that there won't be a new wave and a new peak again. A series of sero-surveys conducted in various Indian cities showed that the infection was far more widespread than what the numbers officially tell us. Most of these numbers don't show up on official tolls because the individuals concerned might have been asymptomatic or may never have been tested. A sero-survey picks up on earlier infections too, as it tests the antibodies developed in response to COVID-19. Unlike the infection, the antibodies are present for a longer period of time. According to Karnataka's sero-survey result, which was conducted in early September, almost 27.3% of people, that is around 1.93 crore of the total population of the state, have been infected with the novel coronavirus so far. 16.4% of more than 15,000 people surveyed showed that the subjects were infected in the past and had developed IgG antibodies against the SARS-CoV-2 virus. 12.7% of the apparently healthy population in the surveyed area had an acute and active infection. On an average in the state, it was estimated that there were 40 undetected infected individuals for every RT-PCR confirmed case, which is called the case-to-infection ratio, which is 1:40 in Karnataka. Across 30 districts in Karnataka, this ranges from 10 to 111. Densely populated city pockets may have been reporting high cases, but the infection continues to spread through rural areas. Here, it is important to remember that rural areas have fewer testing facilities and poor public health care. Many cases as well as COVID-related deaths might go unreported. Hence, the recent fall in numbers may be largely an urban trend and the number of cases may continue to be underreported in areas outside urban centers. Which brings us to the question, should you let your guard down? And should you really be making plans for Diwali? Take a look at Europe. Several countries have seen a surge in cases once again, leading to lockdowns in multiple countries. Knowing this, would you let your guard down in the next few months? The falling numbers are only a part of the story. The novel coronavirus is here to stay, at least for some time. In the next few weeks, we will look at stories that matter to you. If you have feedback or suggestions, or if there are questions you want answered, let us know in the comments below. Until next week, stay safe.